Ladies and gentlemen, my name is Dr. Takayuki Okada. I'm the director of the Okada Medical Clinic, Brisbane, Australia. I will present the preview of our poster presentation titled Pathology of the Okadaella gastrococcus infection among the younger generation. I have collaborated with Dr. Graham Adkins, who is a pathologist at Sullivan and Nicolaides Private Pathology, Brisbane, Australia. Associate Professor Kazutoshi Hori at the Department of Lower Gastroenterology, Professor Hiroto Miwa at the Department of Upper Gastroenterology and Internal Medicine at Hyogo College of Medicine, Nishinomiya, Hyogo, Japan. Disclosure and conflict of interest to declare is shown in the slide. As an introduction, I will present the profile of Okadaella gastrococcus. I call it from now on as OG, although you may confuse with my OG accent. The figure shows the nature of this organism. OG is a gram-negative coccoid bacterium, which has been isolated and cultured from the human stomach. At the moment, it is classified as Streptococcaceae by 16S-RNA study. It has accession numbers ATCC BAA2258, NBRC 107862, GenBank HQ699465. The bacterium possesses unipolar flagella and fimbriae. It is motile and acid tolerant. The bacteria urease catalase oxidase negative and arginine aminopeptidase positive. Based on our research over past many years, it is intracellular and does coexist always in the Helicobacter pylori and Helicobacter helminthii associated gastrointestinal pathology. For instance, TEM at the left upper corner shows the extracellular Helicobacter pylori and numerous intracellular OG. Intracellular presence of OG by histochemistry, immunohistochemistry, and electron microscopy in various pathologies such as esophagitis, erosion of GE junction, adenocarcinoma of GE junction, gastritis, gastric erosion, gastric ulcer, gastric polyp, gastric adenoma, adenocarcinoma of the stomach, mouth lymphoma, large B-cell lymphoma, duodenitis, and duodenal ulcer have been shown by us. The figure shows Helicobacter pylori negative gastric ulcer and erosion with isolated and gram-stained OG and intralesional OG demonstrated by TEM. The figure shows the intracellular and intravascular presence of OG immunoreactivity in the area of intestinal metaplasia. TEM from the different case with bleeding gastric ulcer erosion confirmed the findings. The figure shows the presence of OG in Barrett esophagus and in the erosive esophagitis demonstrated by a modified Allicin yellow and Toledan blue called AYTB stain method. We have shown the presence of organisms by AYTB stain during DDW 2001 in the classical cancer cascades. This is the first bacteria shown the intracellular presence in the gastric carcinogenic cascades, namely chronic inflammation, atrophy, intestinal metaplasia, dysplasia, and cancer. We estimated that probably 75% of the world population may have infected by this bacteria, although the majority of people remains asymptomatic. The figure shows the presence of OG in active chronic gastritis and gastric atrophy by AYTB stain. The figure shows the intracellular OG in the intestinal metaplasia and dysplasia by TEM and immunohistochemistry. OG attaches on the surface of the nucleus of the dysplastic cell, which suggests the possible involvement in the mutation and cancer development. The figure confirmed the intracellular OG presence in the intestinal metaplasia and the dysplasia by AYTB stain. The figure shows the numerous OG in the adenocarcinoma of the stomach by Wassi-Starry silver stain and AYTB stain. The figure shows the intracellular presence of OG by TEM in the adenocarcinoma of the GE junction, and the case where the patient who had a persistent OG infection has developed adenocarcinoma of the stomach 5.5 years after the successful H. pylori eradication. The figure shows a case of a diffuse large B-cell lymphoma with intracellular OG in the lymphoma cells. The figure shows a strong OG immunoreactive case of a gastric marrow lymphoma. The next diagram summarizes the findings from our studies. There is an increasing instance of H. pylori negative and NSAID negative gastritis in many countries, and gastric cancer may be found among the young generation. Therefore, we studied the pathology of OG among the younger generation. Intracellular OG has been found to be associated with H. pylori negative various pathologies, including in the inflammation of a GE junction, active chronic gastritis, gastric erosions, gastric congestion and edema, gastric hemorrhage, and duodenitis. Preneoplastic lesion, intestinal metaplasia was found in some patients. We would like you to attend our poster presentation for 3 major reasons. To understand, firstly, the nature of Okadaella gastrococcus. Secondly, the pathogenesis of Okadaella gastrococcus. And finally, how it is affecting the younger generation. I'm looking forward to seeing you there May 21st. Thank you for your attention.